Um, I suspect this is the panel on which I need to say almost nothing. So I will just let you have at it. And if I have questions I want to ask or redirect, I will do that. And anyone can begin. Anyone can engage. There's no order. There's no structure.
No, let Vinny go first. He always has a lot to say.
We can react to Vinny.
Yeah, we can react to Vinny.
This is interesting. So, there was a lot of great questions being asked, thrown back and forth. I guess I just want to start with an overall thought about the work we do, right? Which is we take a bunch of troubled young people, gotten in trouble with the law, whether that's fair or not, doesn't really matter because here they are. And then we have hundreds of thousands of them if you add them all up statewide, and you got the kids in the child welfare system and the kids on probation, the kids in correctional facilities, and probably tens of thousands government workers, nonprofit organizations trying to do some combination of confine them for their safety and our safety and change their minds, change their thinking, get them to behave better. And this is, didn't just get invented last week. It's historically, it's existed since the 1800s. And I think we just sort of need to think about this as it's a process that stinks and inevitably will have a stink attached to it. And so all this research you guys are going to do, it's really sort of gradations of that stink, right? That it stink less than it stunk before. But don't think at the end of it, it's ever not going to stink, right? You have a bunch of government bureaucrats and a bunch of troubled kids. We can deprive them of their liberty. We can help them in wonderful ways. We can fail to help them in wonderful ways. By and large, there's going to be failure attached to that. And I think one could even go so far as to say there's going to be failure attached to that in significant numbers almost no matter what we do. The government can't rub up against the individual liberty of troubled young people without having that be problematic. And so I think at probation, when I was there, we always used to focus on doing less harm, doing more good, and doing it in the community. That was our sort of mantra. And it's interesting how even as that evolved, my communications guy changed it to doing no harm because he didn't want me to admit that we were doing some harm. And we are doing some harm. We will always do some harm. There's iatrogenic effects to the work we do. I take Lipitor. My doctor, checks my liver functions. Not because he's a mean doctor who wants to hurt my liver. He wants to help my cholesterol and recognizes that during the process of that, he's probably going to hurt my liver. At some point or another, I got to stop taking Lipitor and eat less red meat, right? Or whatever I got to do. And so, I think this was a good way of de-stinkifying. I don't think it was a perfect way of de-stinkifying, and I think there was some stink attached to it. The good parts were, I think the kids were too far from their homes. I don't know who was saying it didn't matter, that they were far away. I wasn't one of those. I don't think I was. If I did, I take it back. They shouldn't have been far away, right? But that wasn't the best thing, and the best thing wasn't saving the money either. And I think that was pretty clear for all of us. We weren't allowed.
Yeah, nobody was doing this. I mean, I don't know where that came from, that we were actually trying to do this to save money. Because that was never part of the calculation. It really wasn't. We understood that this was going to be really, really expensive. There might have been other disconnects, but money wasn't at the heart of it.
Was it less than savings? I think some of the conversations at some points were about redirecting money towards a larger continuum. And I think that's the part that has not necessarily yet happened, but needs to be front and center. I think she was.
I was just going to
agree with that.
Yeah, I was just going to say that because it wasn't about saving money, but it was about using resources better. And because if you couldn't think up a more inefficient use of resources than the way that it was before, right? So there was a 60% drop in youth and placement from New York City into state facilities, yet the per diem costs had increased by 125%. And so as we were sending fewer young people into the state facilities, the city, and the state, they were spending so many $1 million more, and it was partly, we all know that there was, there was a state law that you couldn't close facilities for a year after Gladys made announcements to close facilities, so you had these empty facilities, but it was an incredible waste of resources, and so I think that was definitely one of the main things that got, certain people on board with close to home was, we could use these resources in a much more efficient and effective way than it was being used before. And it wasn't necessarily about saving the money, but it was definitely a better use.
I think you're right. I think we should always remember that the funding formula for the state facilities is the same funding formula for detention. So the waste that we saw on the state side is the waste that we saw on the city side, wearing my other hat. Mm-hmm. So, the city's lawsuit was really interesting because we had a really strong counterclaim. But, I think that we have to remember that close to home is, in its infancy. It's, an immature system. A lot has happened in 2 years. And one of the things that I would be remiss, and Felipe Franco, who's my deputy for juvenile justice, would kill me if I did not mention the fact that all of us have been very concerned about the AWOLs, for instance. It's down to 6%, which is really, really low. And so, we need to understand that, as we work to improve close to home, we will see the system mature and do better by young people, because that really is the focus. And one thing I say often, because, I wore, during the negotiations for close to home, I wore a different hat. I was the state commissioner for the Office of Children and Families. And I will say, and Vinny has said this too, the important part of close to home was bringing children back into communities. Now, the state could have done that, and the state had started to do that, and the city could do that. Either one of us is quite capable of running a really poor system, right? It's not who runs it.
That's exactly.
I just, so now I'm in a position as the city commissioner of running close to home, which is like really unique position to be in. And so I do think that the intent wasn't really to replace one system with the same system at the local level. And I think that's where we need to do a lot more work. And some conversation about, our focus in close to home, have we lost sight of other really necessary reforms? And I don't think anybody thought it was an either-or thing, right? But I think that what we need to focus a lot of energy is continuing to narrow that front door. We shouldn't be having misdemeanors come into the system. We should just not. Those young people should not be incarcerated. They should be in their communities with services wrapped around them and their families. If Texas can do it, right? Not a bastion of, liberal thought there. New York should be able to do that. And so we need to be focused really on really defining who needs to be deprived of their liberty. I think we continue not to, to be very, I think, cavalier about depriving young people of their liberty. And we do it for crimes that are not violent, and for minor crimes, and for offenses and for behavior that upsets adults. We continue to do a lot of that, and for even when young people do engage in very in disruptive and harmful behavior, there are interventions in the community that can address the needs of that young person and their family in their community. And that's where I think we need to focus a lot more of our energy. So, anybody want to weigh in?
Yeah, I mean, there's a lot of what you said I agree with, and I want to just sort of go to Dr. Martin's comments, where you posed a nice sort of dichotomy of reducing the number of kids placed versus quality, and you said you didn't think we had to choose, and I think Gladys echoed that, and I agree. I think there's really, for me, there were four things, right? Two of them were those two. How many kids are we locking up? What's the quality of their confinement? But there are two other things I think that close to home helped advance the ball on, will continue to help advance the ball on, that were also important factors. One is improving the quality of programs that kids get when they're not locked up, and I think the expansion of the continuum also in its infancy is important there, and there's been an increase in the percent of placements going into the alternatives, right? So the rate at which kids get those alternatives. And then the increase in proximity, which I think is not trivial. And again, I don't know how that got translated into the report, but I'll be making my comments on that. I don't think that's a trivial matter, although I agree with Gladys. Either the state or the city could have done that. And I just want to make one comment on Jen's presentation, which is if there was a 16% increase in the rate at which cases are being petitioned and a 4% decline in placements, that's a non-trivial difference. I just want to say that. We zipped past it. Somebody decided not to have charts. If we had seen that chart, we would have seen 16 up and 4% down. It might have been a little more stark, but somebody's playing with social media today for some reason. I don't know why I didn't just do the old school chart up on the wall. But it would have shown that that's a pretty significant, and it's a significant dip/not increase when you factor in a couple other things, which is one is the judges had a lot of new toys to play with, and they could have played with them. They could have said, wow, these are nice facilities. We should put kids in them. And they didn't. They had the opportunity to because they had a higher percent of cases petitioned, and they were petitioned for more serious offenses, so more felonies, less misdemeanors, or the decline in felonies was less than a misdemeanor decline. So there could have been an increase in placements because of the more severe, the higher severity of petitions and the increase in the rate, but there wasn't. And so I think that's not a trivial thing to applaud ourselves on while we remain ever vigilant that the future continues to push it in that direction.
I thought let me just speak about the children because they are in our custody in the private agencies, and I made a quick couple points of things that I see as working, and certainly every one of them needs a lot more work. We work with the specialized cohort. So these are the teens, boys and girls, who are considered in the hard-to-place category, the adjudicated sex offenders, serious mental illness, problematic sexual behavior, and fire setter. So it's a short list, but we work with about 90% of them. And I've had the pleasure of knowing many of them personally because I meet them as I walk through the programs. And here are things that are working and the things that we need to do more work on. I'll start with the easy ones. We are doing much better work on relationship building. So we are there earlier because it's close to home, and the relationship work is much more persistent. We are doing a better job at reminding ourselves that these are not bad kids, but these are kids who bad things have happened to. I know it's easy to say that, but when you're in the midst of a crisis, it's the first thing you forget, because in the midst of the crisis, you think of that teenager as being a problem child. I think we're doing a better job of identifying at least one stable, appropriate, willing adult relationship. We need to do a lot more there, but I'd take a risk and tell you that it's the closest thing to a magic bullet we have in this system, that if we can find one willing, responsible adult, the chances for discharge and stability are far better than any other system-imposed solution. In those cases where we find those families or that adult relationship, I think we are doing much more the family engagement and the capacity building of that family, right? And sometimes it's as simple as teaching that person to set limits. It's as simple as that. And it's hard to believe, but sometimes it's as that simple. We are doing a better job at identifying crossover youth. I mean, so many of our children have crossover experiences, but we think it's about 20% that require a plan early on, because in the absence of that plan, they would languish in the system. They have child welfare cases open, they have neglect petitions, so crossover has become easier to identify. One place where we struggle a little, but are doing better, is what we call the 2 to 5% problem, which is how do we separate the 2 to 5% of the youngsters that are misdiagnosed at high risk of causing a lot of trouble and also influencing others. That are the 95% that are low-risk offenders that should just be out of the system as quickly as possible. So it's mitigating the risk to the others is happening a little bit earlier. I think, and Felipe gets a lot of the credit for this. Early on, he's made it important and has made it a much more clearer picture that we need to invest in aftercare and begin to look at aftercare as a measurable outcome. So all the good stuff that really happens is going to happen when the youngster leaves the placement system. And we need to look much more closely at aftercare. We've done some good work, but I think it's getting better. So leading into some of the more difficult challenges, we are still struggling to really define the two populations. One has significant situational mental illness, and the other has chronic and persistent mental illness. And this is important because we constantly talk about trauma, and I think people, maybe not in this group, but in general, make the mistake of equating trauma to mental illness. That's not true. Less than 30% of our kids have chronic and persistent. Most of them have situational. They're angry, they're scared, they've been hurt, so their behaviors seem to exhibit mental illness. But in time, through a relationship, you find this incredibly fast decline in symptoms, and you begin to see the 70% of our young people who are not mentally ill, they're just scared and broken. And I think we need to get the word out that trauma doesn't equate to mental illness at all. A little more difficult is to find ways to invest in the frontline workforce, because that's where all the good things really happen. In fact, on our front lines is where, when young people don't have that one appropriate, stable relationship, it's from our frontline workforce that we find people stepping up and saying, I'll be there for that young person. That's where a lot of that heartfelt, sincere commitment continues to happen, and it's not happening with our PhDs and our clinicians. Don't get me wrong, someone is going to quote me. They do great work. They do great work, but the heartfelt, connection, the lack of fear around our young people, and the willingness to go the extra mile is still happening at the front line. And finally, I think one place where we struggle, and I didn't hear it come up once before, so I'll tell you now, our system is truly black and white. It's black kids and brown kids. It's not white and Asian kids, right? They're coming from a few neighborhoods that have been historically segregated, and our work is about social injustice. I don't want to even talk about social justice. That's kind of a wish list item that I'd like to get one day. I think we need to, with our staff, the biggest challenge is to constantly remind them and remind ourselves and remind myself that we work in a system that's inherently unjust, and that if we really want to do something better in the long term, because it'll take years to change this, that at least we need to be like the alcoholic that's in recovery and remind ourselves every day that this is a system that's black and brown. It's not white and it's not Asian.
I want to move on to questions soon, but I want to give two people a chance to say something more extensive if they want to. One's Commissioner Bermudez. No. You don't have to.
No, I mean, people have said a lot of the things that I would have said. So, and I just want to echo what Jeremy just said, because we're in the process also of looking at that from the probation perspective, because it's very easy to say, well, that's how arrests come in and we don't, there's nothing we can do, but there's a lot we can do at every stage of the game. And so we're going to be tackling that for sure, both in our juvenile and adult systems. So we can't forget. It's too easy to forget because that's the system, and thank you for reminding us of that. So, the only things that I would say is that what Gladys said before and what Vinny said before, that we have to look at this from a wider scope of the whole continuum of the system, and not just close to home should, because of its name and because of, we needed to really put a sort of laser look on this because of the way the system was. expensive. It's the highest intervention. I mean, the most obviously most incapacitating of all the interventions. But we can't forget that there's things we can do much earlier to still prevent the confinement of young people at that stage of the game, even that far in. So that will need better incentives, fiscal incentives, as well as other incentives to keep kids out of the system, and to, I hope somebody is listening to us when we say, let's get rid of the misdemeanors in detention and placement.
Yeah, so one point I wanted to make is that I think one of the other benefits about close to home that we really haven't talked about is this issue of accountability. And so, as Jeremy said, it's just a few neighborhoods that are really affected by the juvenile justice system. And so by having the system close to home, it can be more accountable to those communities and more accountable to those families in those neighborhoods that are really impacted by the system. And so, I think that it's ironic that the state system, in a lot of ways, was more accountable than the city system before close to home. I mean, when Gladys became commissioner, she really did a lot of work to increase transparency of the OCFS facilities. Like before 2007, before she was commissioner, the OCFS facilities were a complete black hole. Young people would be sent away to those facilities. No one knew what was happening to them in those facilities. I mean, the DOJ investigation sort of uncovered for the world what we all kind of, on the ground knew was happening to young people in terms of the abuses that was happening. But Gladys really worked very, very hard to change those conditions inside the facilities. And I don't think she brought a lot of attention to that work because she was also really focused on closing the facilities. But so that some of the examples were that before she was commissioner in 2007, when John Johnson was commissioner, for 15 years, there was supposed to be an independent review board that hadn't met for 15 years. There was also supposed to be an ombudsman's office. There was only one ombudsman that was supposed to look at monitor conditions in 31 facilities. So when Gladys became commissioner, she staffed up the ombudsman's office. She reconvened the independent review board, put advocates on it, including me. She created the sanctuary model to reduce placements, to reduce restraints inside the facility, worked with advocates to create an LGBT policy. And these are all things that the state was doing that the city wasn't doing. And I think part of the reason the city wasn't doing it was it wasn't working collaboratively with advocates. And so I think that now, that's why I'm personally thrilled that Gladys and Felipe are now in charge of the city system, because there's really an opportunity to really increase transparency, to make the system more accountable to the people who are affected by it, to have greater oversight. And now that people are close to the facilities, you can have these community advisory boards, these review boards really working closely, monitoring what's happening inside the facilities. That's much harder to do when the facilities are 8 hours away from community members. So there's a lot of opportunity now to make the system more accountable. And I think that's one of the benefits of close to home that I think we need to recognize.
Jeff, can I just add one last thing? I'm surprised we haven't even talked about, because it's one of our main points usually, is the education component of this. The fact that the young people in the facilities are being educated by the City Department of Education. They can gain credits. They can be in a better place when they come out in terms of their educational achievement. It's not perfect, but it's definitely, we've made great strides in that regard, and we're constantly improving the way we do the work so that there's better educational outcomes too.
Okay. I do want to get to a few questions. I know that Commissioner Carrion has to leave pretty soon. But we have an opportunity here to ask questions. We have a provider at the end of the table. We have 3 government officials and a professional troublemaker right here. So please, questions from the floor. Jane? And identify yourself.
I'm Jane Spinnick. Vinny, you said that you were talking about how the judges didn't play with the toys they had, so that the placement rates actually went down. And I was curious whether any of you have some thoughts about how the judges were educated to do that. So what factors went into getting the judges to think differently about that?
You want to?
Yeah, no, well, I was just going to mention that, when the DOJ report came out, and I should clarify this, we, under Patterson, had created a task force to transform juvenile justice. And that was done before the DOJ investigation started. And we held up our final report after DOJ issued its findings so we could reflect on their findings. But that work was ongoing. But as soon as the DOJ report, just to give you one example, came out, which, you know, I embraced. I mean, there was nothing new there. I knew the horror of, you know, some of the challenges that we had. So it wasn't any new information. It was horrific reading 33 pages where it was outlined in summary fashion. But, you know, I went and met with the judges. And I had a meeting with the senior leadership of across the state for family court and said that the report from DOJ was accurate and that you know, and talked about the task force. And I said to them very, very clearly, and I'll never forget that, they were really incredibly receptive, where I said, listen, do not send young people into my system to address their needs. If you think that my system is going to address their mental health needs, that's not happening. So unless they truly pose a risk to public safety, they don't belong in my system. And that then resulted in a letter that was sent by the chief administrative judge to all the family court judges outlining that. And we saw almost immediately a tremendous drop in the number of young people being referred. And having a conversation and engaging and answering their questions and being very transparent and honest about what you could get in my system at that point in time. I mean, there's been tremendous change in the state system, and that will continue to happen to improve the state system. But the judges, I don't think, understood what was happening in my facilities and what they were doing to young people very unintentionally. Once they knew about it, behavior changed. I mean, a lot more had to happen, but I think, Vinny, you would agree with that.
Oh, yeah. I mean, you know, what I was getting at with my stink thing at the beginning was that everywhere along the road, there are these potential unintended consequences, the Lipitor and the, right? And so Gladys has now educated the judges. We got them, right? They're scared as hell to send a kid up, right? And now we open up a bunch of nice new places in the neighborhoods, and we're like, oh my God, what's going to happen, right? So we did a bunch of stuff. I mean, right around when the governor and the mayor were touring the facilities and coming out with these strong statements about how crazy this is, we established a little bureaucrat sort of bunch of meetings, right, that Mishi was staffing, right, that me and John Mattingly at the time were co-chairing the Juvenile Justice Advisory Committee. We're creating a grid that says don't send the misdemeanants, don't send the low-level guys, put them in either nothing or the alternatives, and only reserve the facilities for the highest severity, highest risk kids, right? And we're expanding the continuum, but what we're doing is all in conversation with the key stakeholders, and then, which included the judges, and then once it's done, Anna, who's the head of juvenile for probation, goes around and does a sales job with all the key stakeholders in the boroughs, because they weren't in the meetings, right? So it doesn't matter what the head judge says. I'm in Staten Island. I know Staten Island kids are different than them damn Manhattan kids, so I'm going to put my, right? So we got to go make that sale, and Anna can take it from there.
Yeah, no, I mean, we did a lot of local stuff, as well as, you know, the leadership of Judge Richardson Mendelson in, you know, for the judiciary, but they were included in a lot of the interagency work. And whenever we went, I took the, you know, opportunity to talk about how risk, need, responsivity works, and how, like, you reserve the highest intervention for the highest combination of offense and risk, because offense is not everything, risk is not everything, and this should. And we hammered out this is not a social service, system. This is a juvenile justice system. Social needs should be taken care of by other pieces of our government or other entities, private, you know, nonprofits and whatever. So we were constantly driving that message, no matter who we met with, basically.
My name's Abigail Kramer. I'm from the Center for New York City Affairs, and I'm going to try and contort two questions into one. So, Jeremy, you made reference to the very small number of kids who do pose a higher risk than the majority of kids who are in the system. So what are the mechanisms for sending kids into secure placements, and what are the rates at which kids have been moved up through the system? What does that look like? Mishi, you mentioned community accountability. What are the mechanisms for community accountability? How well are they working and how strong are they?
Abigail, I don't know the exact rates. I think someone else may be able to give us that. What we find with that small group is, one, in that group there's also a separation. The first group that you need to identify there, at least from a practice perspective, is the kid that feels completely hopeless, right? I have nothing to look forward to. I have no place to go. So what does it matter if I do something? I mean, what more could you possibly take away from me? I've actually twice in the last year had a young man tell me, one boy and one girl tell me that in the exact same way, saying, what more could you possibly do to me? And that's a situation where I think we struggle to address, but it can be addressed. It's making sure that we wrap ourselves around, you know, in the young girl's case, family finding really helped because for the first time she saw us aggressively looking beyond the case record, having our family finders out there, making calls, talking to her, asking her questions. So, you know, how did you come into this system? Was there ever a teacher? It at least gave us some reason to stay engaged in the process, which ultimately helped. Then there's this group where, you know, we say we don't know what to do. We're not equipped to handle this young person. Most recently, we've been working with a young person that's AWOL all the time. And the question is, how many others will he take with him? And at what point does this habitual AWOLing lead to an incident that puts him or others at risk, right? A safety issue. And I think at some point we kind of draw the line and say, working with ACS, working with OCFS, say, look, how many more of these incidents should we tolerate? Because there's a risk to the entire population and probably also a risk to public safety, though in this young man's case, we don't think that's the issue. But in some cases, that could be an issue.
I think that the answer to your question of how many young people have gone into the secure system that's still being run by the state, OCFS has done a really good job of guarding that door and challenging when the city does want to step young people up into the secure system. And so I think that the number have been few because of that oversight. It hasn't been for lack of trying, I think, on the part, I think if I would talk to my old colleagues at OCFS. I think that what we need to be able to do in our system now in the city is really understand that young people are different and you need to have different interventions for young people across the continuum. And so we have to do a better job of that. You know, one thing that I want to share is that we have a lot of challenges in front of us, and one of the challenges that I have now in really trying to solidify and improve on close to home is to take ownership of a juvenile justice system in the city of New York. That this is not a series of contracts that were let out to agencies, to providers. So we need to own it. We need to really inform the policy and what the vision is, and really provide the support and build capacity to be able to meet the needs of all the young people that come into our system. And so, you know, I remain in saying that every young person can be safely in a community unless they pose a risk to public safety. And so it's hard work, and providers are struggling with that, understandably so, because we haven't developed the tools and the continuum and the programs and supports that young people need and their families. So that's a work in progress.
Yeah, in terms of the community accountability, I mean, I think that there's a lot of steps. I mean, there's a lot of things that have already been done, but I think there's a lot of things that can be done to strengthen accountability. I mean, I think one of the most important is just to publicly report data. And so, like, you know, there should be data on the whole system that's reported, you know, on a regular basis so that the communities can have access to that. You know, we talked a little bit about the huge racial disparities in the system, and I think that one sort of strategy that's worked in other places that we could be doing more of is just publicly reporting the data and having it be disaggregated at each decision-making point. So have that data be disaggregated by race, ethnicity. The Burns Institute recommends by race, ethnicity, gender, geography, and offense. I would add sexual orientation and gender identity to that list as well. To have that data, and then what's happening inside the facilities, to have that data be reported regularly. I know that the City Council has required some reporting, but I'm not familiar with how sort of public it is, and so I think that's important. And then to have mechanisms for monitoring and oversight. And I know there is a community advisory board that has really strong membership on that board, as advocates and other folks on that board. So I think that's an important step. I think that advocates have had a very nuanced position on close to home, and one of the reasons they have had a nuanced position is even though they agree in principle that it's better for young people to be in facilities closer to their families or in community programs rather than being sent to OCFS facilities, they had real concerns about the process and how it was implemented in the city, and they felt that community groups did not have as much of a seat at the table as they should have in terms of the planning and implementation of close to home. So I think that there's real opportunities to really strengthen that collaboration with communities so that there is a real sense of everybody is included in a really meaningful way, and so that there's that kind of collaboration. And then the last thing is just building the capacity of community organizations to work with young people in the juvenile justice system. And so, we talk about contracting with providers, and a lot of these providers do really great work, but they're not necessarily rooted in the communities where young people and their families live. And so there needs to be more work to build the capacity of those really truly neighborhood-based organizations that could work with the young people even after they're done with their dispositions. And so to have those long-term relationships, Jeremy talked about the positive relationships with adults. Those programs need the resources to do that. And so, how do you build the capacity of those really truly neighborhood-based organizations that can continue working with young people, up until adulthood, and to build those connections that Felipe was talking about earlier, I think is a really important piece, not only to improve outcomes for young people, but to really have communities very much invested in the juvenile justice system.
Good morning. Hi. I've listened to quite a bit of you.
You identify
talk.
yourself?
You hear me? Okay.
Yeah, just say who you are.
Oh, my name is Andrea Johnson. I'm with the Brooklyn District Attorney's Office, ComAlert, and I work with Community Law Enforcement Reentry Program. I oversee the education reentry program, meaning that I work with gang affiliation and men and women that's on parole, probation. They come to us to get their GED and other services, wraparound services. I hear a lot of people talk about coming closer to home, bringing services to the community, but we have to be mindful that we never spoke about trust. And I think when kids go through the system, they lose a lack of trust, not just with themselves, but also the person that's standing before them, because they're treated as if they're an individual, like, oh, you're nothing. So what I do with my kids is I'm mindful that I could be on the other side as well at any given time. A lot of the youth come to me, they're very disgruntled, they're impatient, they're frustrated, and they have no sense of trust. And that stems from the home. I think a lot of that stems from the home. A lot of the programs that was family-based programs due to funding was actually vamped. They was taken out of the system. And I think if we get to the root of the problem with not just family violence, but community violence, and we address those issues at home with a lot of outdoor activities, not so much community fairs, but activities that the families can get out the city, get out the 5 boroughs to enjoy, to see themselves long term, that they can be a family. There's not always a violence, but it's also addressing the issue before it even comes up. I myself come from a family of 18, so I've went through all of the system. And every time I was brought forth to a social worker, I didn't like them. I was like, a social worker, she's just going to take me away from my family. Rather, it's a foster family, and you're just starting to get used to it, and you're pulled out of it because they have to find another place for you and your family. So it's a trust issue that I think we have to start to really address from the beginning. And I think once a person needs to be taken from home, because not every household is trustworthy or the happiest household. And some kids do need to be removed, you know, give and take. But we have to be mindful. Keeping a family together can sometimes be a detrimental issue versus a person that just needs to have a better outlook in life. So that's what I have to say.
You know, I'll put on my child welfare hat because I am also responsible for child welfare in the city, and say that you're absolutely right that the young people both in our foster care system and our juvenile justice system lose trust in the adults in their lives, adults in their family, or those that are supposed to serve them. One thing that I've learned across the many years of doing this work is that even when you remove a young person, and that's the right decision, to remove a young person from their home, let's say in a child welfare setting, that when that young person reaches the age of 18, they go back to that family. And regardless of the experience, in most cases, they go back looking for their roots, for that family. So that really, whether or not, we terminate parental rights, and it's a legal act that we do, that young person will go back. And so it behooves us to continue to work with their families so that there's going to be that connection so that they can manage that relationship, that family can understand that young person who's coming back. We're very quick to give up on families. And so they're great families and they're challenged families. For a young person, when we remove them from their home, at the age of 18, 19, 20, they're going back looking for that family. So we need to do better.
Do any panelists have any final comments that are they've got to come out that you need to say? No? Okay. Well, I see people are starting to dribble out, and I know a couple of people have to leave for a meeting. So I just want to wrap up by saying thank you to everyone for being here. Keep an eye on the websites of the Pinkerton Fellowship Initiative and the Prisoner Reentry Institute here at John Jay, and our website at the Research and Evaluation Center, where this report is being posted, and where, again, we hope you participate and make comments and help us wrap it up. And we look forward to seeing you at the next symposium. Thank you very much.